get into the specific issues like eczema, rosacea, um, psoriasis, because people listening have these different issues and go, well, maybe that's fine for acne, but what about rosacea or what about eczema? What is the root cause for these each of these conditions?
Okay, did you want me to start with acne or did
Sure.
you? Okay, so for acne, well, everything, there's an inflammatory component. And inflammation is always rooted deeply for me with toxins and also glucose regulation. So for me, the cornerstone of nutrition is going to be talking about how we can get better glucose regulation in the body. So when we eat certain foods, specifically carbohydrates, they turn into glucose or blood sugar. And then our insulin hormone appropriately elevates to bring that sugar out of the bloodstream into our cells. But when we're doing a lot of things that we do in this day and age, like eating a lot of processed foods or excess sugar or carbohydrates that turn into sugar, I'm so surprised when I hear a lot of patients say that, oh, I'm not eating a lot of sugar, but then you ask about their diet and they're having a bagel for breakfast and waffles for lunch and a sandwich for dinner. So all these things turn into sugar in the body. And what happens is when there's this increase of glucose, increase of insulin, then our bodies are just like this all day long roller coaster, and that causes inflammation. So at the root, there's always inflammation for every entity you mentioned, whether it be acne, eczema, psoriasis, rosacea. Then for each and every condition, there's also the toxin overload. So, are you using a lot of endocrine disrupting things in your life? So, are there lots of BPA from plastics? Are there lots of phthalates and parabens from your cosmetics? Are there lots of nonstick cookware that you use that has PFAS? And so all of these become root cause across the board. Now, where it starts to vary is where your immune system works. So, with acne, there are certain factors. There's a conglomerate of different modulators in the body. So, not to bore people, but there's mTOR and FOXO1, and they're kind of like antagonistic. And so, the villain in acne would be mTOR, and things that increase mTOR will increase oil production, which is one of the major things. So, with acne, there's an excess of sebum or oil production, and then you have your cells don't turn over, so the follicles get sticky, because that's where acne happens, in the hair follicles. And then you have inflammation and buildup of bacteria and even fungus. And
Mhm.
so things that increase that mTOR are going to be foods like wheat and meat and dairy, because they increase an amino acid called leucine, which will aggravate this cycle and makes oilier skin. And insulin can do that too, and affect your male dominant hormones like androgens, which even as women we have. So those are the very specifics of acne. And that's where you need to really work on nutrition and also toxin management. With acne as well, we see, like I said, a preponderance of H. pylori. So I see that when we get that to be in check, that really helps. With eczema, it's a certain arm of the immune system. Again, inflammation that causes skin barrier disruption. And what I also see a lot with eczema is, and it's not something you find in many testing because it's hard to pick up, but some parasites can be issues. And I know that's kind of like a tough topic because not we don't really learn about those as much as we should, but they are a big deal. So eczema can also be triggered by that. And then for psoriasis, it's a different arm of the immune system, and that it's called the Th1 arm versus eczema, which is the Th2. There could be some overlap with eczema, but with psoriasis, it's mostly that Th1. And I find that, there are other overgrowth organisms that show up with eczema and psoriasis that I see more often than I do with acne. So those are your major root causes. And with rosacea, I'm telling you, so many of the people have gut symptoms, whether it's this SIBO entity of the small intestinal bacterial overgrowth. But it's really tremendous how many people with rosacea specifically have that abundance of inflammation and overgrowth in their gut.
It was funny. I was watching a newscaster the other day, and his face looked like he had a ton of makeup on, and it was a man. So that's not normal. But then his neck was all red and blotchy, and you could tell they were trying to hide something that was everywhere, but they forgot to put the makeup on his neck. And so it's just a sign of inflammation, red heat coming out.